Assalamu alaikum. Today we are going to discuss some information regarding hyperlipidemia. Hyperlipidemia is a common disease nowadays. What is it? Basically, abnormal increase in the lipids as well as the lipoproteins, which can lead to various coronary vascular events, cerebrovascular events, as well as the peripheral arterial disease. The total cholesterol in the body can be broken down into various categories like LDL, VLDL, HDL, triglycerides. Each have a different value. Most important values that should be considered by a physician are total cholesterol, LDL, triglyceride, and HDL. HDL is basically a healthy cholesterol. Its higher values are better for the body, and the rest of the cholesterol should be lower. So there is many types of hyperlipidemia as well, which includes predominantly hypertriglyceridemia, predominantly hypercholesterolemia, and mixed type. So different combination of drugs are important to treat these different types of hyperlipidemias. So modern epidemiological studies have established the fact that elevated plasma cholesterol level they lead to the coronary artery disease by changing the arterial wall. There can be the thrombosis formation that leads to coronary artery events including myocardial infarction and angina, and they can lead to this stroke as well. It can lead to peripheral arterial disease as well. So it's very important to treat them to avoid these events. So hyperlipidemia occurs because of a cause. There can be a genetic cause, there can be a secondary cause. Genetic, which is also called a primary cause. In secondary causes, we should think about the other systems in the body that can contribute to hyperlipidemia. Basically, there are two factors. If we see A to the genetic factors and B to the environmental factors like lack of physical activity, like dietary contributions, eating high fat diet, it can lead to hyperlipidemia, which is denoted by C. So basically, it's an interplay between the genetic and environmental factors. However, there are certain systemic problems, including certain endocrine problems, certain GIT problem, certain psychiatric issues. Then there can be some renal issues that can lead to hyperlipidemia, and a physician should focus upon these causes because then it would be treatable. To treat the underlying cause, the hyperlipidemia will be settled. And last but not the least important is drugs should be considered as a cause of abnormal lipid profile in the body. So endocrine causes, the most important two organs are pancreas and thyroid. So hypothyroidism as well as diabetes mellitus can lead to the abnormal lipid profile. In the GIT, the important is obesity, number 1. Number 2, cholestasis. And number 3 is obstructive liver disease. So liver is also an important factor causing the abnormal lipid profile. So psychiatric changes include anorexia nervosa. Abnormal eating habits and excessive dieting can lead to abnormal increase in the lipid profile. The related diseases is any kidney impairment as well as the nephrotic syndrome can lead to deranged lipid profile. Among the drugs, we should consider beta blockers as a cause of the abnormal lipid profile as well as thiazide diuretics. So these causes should be considered by a physician to treat a patient with a hyperlipidemia. There are certain guidelines when and which patient to treat and what value of the hyperlipidemia that we will discuss in a separate video. But for an overview, I will tell you about a certain group of drugs which are available for the treatment of hyperlipidemia. These include number 1, statins, which include atorvastatin, pravastatin, rosuvastatin, simvastatin. Number 2 is ezetimibe. These drugs are used in different combination to treat the patient with hyperlipidemia. Number 3 is fibrates, which are basically important for to treat the patient with the triglycerides when the triglyceride levels are high. These include gemfibrozil as well as fenofibrate. Then we have bile acid binding resins, which are cholestyramine and cholesterol. In addition to that, there is nicotinic acid and N3 fatty acid, which are received from the cod liver oil capsules. So these are basically the overview of the patient with hyperlipidemia and which group of drugs are used to treat these patients. In a separate video, we will discuss in detail the the risk factors, what investigations should we do, what are the treatment goals in our patient to treat for the hyperlipidemia, and the combination of the drugs that should be used, and how to monitor a patient with a hyperlipidemia. Thank you for watching.